got it from Stephen and Melody. Those are the first.
She's here?
On Zoom.
Zoom?
Yeah. That's all I get from Stephen.
Zoom?
Yeah. I just got it from Emily.
So where's the minister? Minister Dr. Christopher Tufton is not on this.
Stephen.
So good afternoon. Welcome to this very important press conference to speak to the distribution of vaccines to 12 to 18-year-olds. I would like to welcome members of the media as well as in office today, the Honorable Dr. Christopher Tufton, Minister of Health and Wellness. We also have Dr. Grace McLean, Permanent Secretary in the Ministry of Education, Youth and Information. We have Dr. Kassan Troop, Acting Chief Education Officer in the Ministry of Education, Youth and Information on Zoom. Dr. Melody Ennis, Director of Family Health Services, Ministry of Health and Wellness, as well as to make a presentation as well, our Minister, the Honorable Favour Williams, Minister of Education, Youth and Information. We do not expect to be here too long as there are some other engagements that we have to pursue. So we expect the press conference to last no more than probably an hour. We will start off by welcoming the Honorable Dr. Christopher Tufton, who will make a presentation, and then we will move to the Honorable Favour Williams, after which we will take questions from the media. Dr. Tufton.
Thank you very much. The Honorable Robert Morgan, State Minister in the Ministry of Education, Youth and Information. Honorable Favour Williams, Minister of Education, Youth and Information. Dr. McLean, Permanent Secretary in the Ministry of Education, Youth and Information. Dr. Thorpe, Acting Chief Education Officer. Dr. Melody Ennis, who is online, representing Family Health Services at the Ministry of Health and Wellness. Members of the media, distinguished ladies and gentlemen from both education and health, those online, one and all, good afternoon to you. This is an important occasion for the vaccination program and the government's attempt at combating the COVID-19 threat that we all face, and in particular, focusing on a particular age cohort or young people, which my colleague Minister Favour Williams will elaborate on. The vaccination efforts continue, and today, or at this time, we want to speak about our children and teens who, over the next few days, going into this weekend and early new week, we will focus on as we try to address the concerns around the COVID threat to them, and also the issues around them getting back to normal life as it relates to the resumption of school. We begin their vaccination with the Pfizer vaccine on Saturday, and I'm speaking now of the 12 to 18 years old, Saturday, August 21st, and into the next Tuesday, August 24th, as a start, with a focus on our young people 12 years and older with comorbidities. This is for this weekend, as well as those 15 to 18 years across the board. The 15 to 18 years for us are very important because they have exams coming up, and we want to give them an opportunity to get their vaccination, the first dose and the second dose, prior to them resuming face-to-face classes again, which the Minister of Education will speak of. The Pfizer vaccine, which arrived today, and we say thanks to the United States people and government, is proven to be safe and effective, and is approved for use in children and teens. And we are available, the ministry that is, to provide additional information. We received today 204,000 doses as part of a total allocation of over 600,000 doses. And we invite persons, if they have any uncertainties, any issues, parents, guardians, can visit our vaccination.moh.gov.gm to look at this particular vaccine and all the components of it. However, to put it simply, it has gone through all the clinical trials, all the expert assessment, and is deemed to be safe for use in that age cohort, across the board, but in that age cohort. Hence the prioritization of this particular brand on our young people. We encourage parents to turn out to our various vaccination sites with their children beginning this weekend. When you do, we encourage them to take along an ID, a government ID, a copy of the child's birth certificate, to the extent that you have it. Most persons do. If you don't, get a letter from a JP, and that will greatly assist us in the vaccination efforts. And again, I say, this is our priority this weekend from Saturday into Tuesday, the 12 to 18 years old. As at 9 a.m. this morning, our vaccination numbers were up to 420,627. Of that number, some 282,583 were first doses and 137,000 second dose. And we had some single dose through the Johnson & Johnson donation of some 969. Our goal has been to inoculate some 700,000 Jamaicans by the end of September. And the intention is to ensure that our young people forms an important part of that category of vaccinated. So the focus is on them, and on them as priority this weekend, because we want to ensure that they have an opportunity, firstly, to secure themselves health-wise, but secondly, and very importantly, to be able to resume face-to-face classes as quickly as possible, hopefully in September of this year. There are a number of locations that have been identified for this weekend's blitz, if you will, in St. Anne, Monique Teachers College, York Castle, Albutna Gallimore, Marcus Garvey Tech, Turtle River Park, and we will put these out in social media, on mainstream media, on the website, and the days may vary between Saturday or Sunday or both, but these venues are venues which will be convenient in the parish. St. Mary has St. Mary High, St. Amory Anglican Church, Anata Bay Sports Complex, Wycliffe Martin or Brimmervale Housing Scheme, and Highgate Primary. Portland, Port Antonio High, Buff Bay High, and Fair Prospect High. St. Elizabeth, Black River High, Junction, Santa Cruz, Newell, Balaclava, Magotty, Aberdeen, Eldersley, Southfield, Bellevue, and Newmarket health centers. Manchester, Mandeville, Christiana, Cross Keys, and Belfield health centers. And Clarendon, Lionel Town Health Center, Denby, the PS here is high school, right, Denby High School, Clarendon College, Spalding High, and Edwin Allen, Maypen Hospital, and Kellitz High. The KSA we will do every day from Saturday to Tuesday. JC, Jamaica College, St. Andrew High, St. George's College, Merle Grove, the Queen's School, and Excelsior High School. St. Catherine, Portmore Heart Academy, Eltham High, Dintil High, Old Arbor High, Jose Marti, St. Jago Park High, and Guys Hill. And a few days will vary, and we will provide those details. St. Jago Park Health Center, sorry. St. Thomas, it will be Moran Bay Health Center, Yallas Health Center, and Isaac Barrant Health Center. St. James, Mount Alvernia, it will be Type 5 in Montego Bay, Adelphi Health Center, Mount Carey Health Center, Salters Hill Baptist Church, and Sandals Inn. Westmoreland, Mannings High School, Negril Health Center, and Sav Health Center. Hanover, Hopewell Health Center, Hopewell High School, Lucy Health Center, Sandy Bay Health Center, and Green Island Health Center. And that will be Hopewell High School in Hanover. High School. And then Trelawney, we will announce momentarily where in Trelawney. I suspect a few locations to deal with north and south, and I think it's being sorted out. Now, I've gone through this very quickly just to demonstrate that there are multiple locations in each parish. Some are health centers, some are high schools. And they were selected in consultation with the Ministry of Education to determine location from population centers, ease of access, and the personnel and the infrastructure that is required in order to administer the vaccines to those locations. And the days may vary over the 4-day period, so we ask parents, guardians to look out for the advisory around specific days for specific location. You can get that on the ministry's website, I'm sure on the Ministry of Education's website also. And we will also use the local infrastructure, health and education to notify parents, guardians, so that they know exactly which day is most appropriate to them, so that they can bring their youngsters out to benefit from this process. Come next Wednesday, we will resume the vaccination of the general population with both the AstraZeneca and the Pfizer vaccines. We also have 118,000 doses of the Johnson & Johnson vaccine that's on its way, expected to arrive on the 23rd, I think. That's the last date I got. I probably should not have announced it until the plane was in the air, because we've had a lot of missed dates. But I think there is some confidence that we will see the Johnson & Johnson. What that will mean is that we will have 3 brands as of next week. We will have the AstraZeneca, which is the, pardon me, but as the one who received it, I'll say the Old Faithful. It has been around longer than all and has proven very effective to the 300 plus, 400 plus thousand Jamaicans who have benefited from it. And I say so because there is the tendency to express a preference for a particular brand. I know that's happening. The reason why we're targeting young people with the Pfizer is because of the science and the research that has proven that it is safe. Not that the others aren't safe, but we go by what the experts have concluded based on the clinical trials they have done. And we need our young people protected for school and generally. So that's why that is being targeted. But the others, as it relates to the other age cohorts, all the vaccines have been proven effective. So you have the AstraZeneca, which we will have. We have the Pfizer, which is primarily for the young people. And to the extent that we have excess capacity, we will offer to the general population. And then we hope the Johnson & Johnson, the most significant difference being the single jab. So you only need one injection, one jab, and that would complete the dosage. And some people don't like to have a return of the needle, so they may prefer that. But outside of that, in terms of efficacy, safety, all of those things, they are all providing the same. And therefore, we urge persons, don't wait until you think you get the brand you want. All the brands coming in have been tried, tested, and proven. And by next week, hopefully, we will have 3. We encourage the community support in our rollout of vaccination activities, from the identification and setup of the various sites through to sensitization and implementation, and continue to depend on, in this instance, parents and guardians. Remember now, you are going to have to be the ones to take your children out, to give them the appropriate, go ahead, and to provide the information for them to benefit from this program. To become vaccinated, members of the public are encouraged, ideally, to register on the Ministry of Health, moh.gov.gm, or call the helpline 8881-LOVE. That's 888-663-5683. That's the ideal. We're not turning away anyone from walking in, though. The reason why we prefer registration, it's easier to manage, it's more efficient. But don't not come if you didn't get to register online, and we have said that over and over. Once you have received your confirmation, then clearly it will give you the time, the place, and you take whatever you're asked to take. We will also be doing some mobile sites as the case may allow. But today is for our young people, and so let us focus on that. I want to thank the Minister of Education and the Minister of State, and indeed the ministry staff, and indeed the government, for the efforts of collaboration with the Ministry of Health and Wellness. This weekend is for our young people, 12 to 18 years old. Visit a site near you to get vaccinated using the Pfizer vaccine, which is a vaccine that is recommended for that age cohort. 12 to 14, we prefer this weekend that those with comorbidities come, not all the 12 to 14, because it's a large number, and we want to schedule in a way that gives some priority to the 15 to 18 years old, because we want to give them the second jab early enough to start school in September in preparation for exams and so on. So that's the rationale behind it. But that's where the focus will be. I want to thank the health team in the regions for the efforts at organizing and putting this together, and I'm available to answer any questions after. Thank you very much.
Thank you very much, Dr. Tufton. As we sanitize the podium, we will welcome our own minister, the Honorable Favour Williams, who will also give her presentation.
Thank you so much. Good afternoon, ladies and gentlemen. Sorry about that. So let me acknowledge the Honorable Robert Nesta Morgan, Minister of State, Minister of Education, Youth and Information, the Honorable Dr. Christopher Tufton, Minister of Health and Wellness, our own Dr. Grace McLean, our Permanent Secretary Acting, our Chief Education Officer, Dr. Troop, representatives of the Ministry of Education, Youth and Information, and the Ministry of Health and Wellness, members of the media, distinguished ladies and gentlemen, thank you for joining us this afternoon for the press briefing as we share information on the plans for the vaccination campaign targeting children ages 12 and over, and with a particular focus this weekend on our students in grades 10, 11, 12, and 13. The Ministry of Education, Youth and Information is extremely happy for the donation, the total donation of over 600,000 doses of the Pfizer vaccines, with the first tranche being received today from the U.S. government, and as was indicated earlier, being prioritized for the inoculation of our young people. This morning, I was elated to be at the airport along with Dr. Tufton, Senator Kamina Johnson, and of course the Prime Minister, to accept the arrival of the vaccinations, or of the vaccines. This is a very important development in our collective efforts to ensure that more of our people get vaccinated against the COVID-19 virus. Many parents and teachers are anxious to see the education sector return to normalcy, or as near normal operations as possible. And a public education campaign to encourage parents to get their children vaccinated is one of the vehicles we're using to get more people to embrace this important public health initiative. All Jamaicans, by now, I know that they understand the current phase of the pandemic with which we are faced. The presence of the Delta variant and the current COVID numbers from the Ministry of Health and Wellness makes this a very critical phase in doing all we can to prevent further spread. To date, more than 60% of the public sector teachers have been vaccinated, and this vaccination rate is well in excess of that of the general population, and so we want to commend our teachers. And we believe that the message from the education sector is that the education sector cares. Our stakeholders in the education sector want to see our children back in the face-to-face environment, back in the classrooms with their teachers and their classmates. And so this gift of these vaccines will most certainly help us in this effort. When we heard that the gift of the vaccines was on its way, we did a survey to find out kind of where's the leaning of our parents with regards to this. And we're happy to report that when asked if they would give consent for their child to take the 2 doses of the Pfizer vaccine 3 weeks apart, approximately 59% of parents are willing to have their child vaccinated. More important, when asked if they accompanied their child to be vaccinated and they as parents are not vaccinated, would they be willing to be vaccinated along with their child? And 64% of parents said they are willing to be vaccinated along with their child or children. And this suggests that we will be off to a good start in terms of the take-up of these vaccines. So starting this weekend and using health centers and educational facilities, and you would have heard Dr. Tufton read down the list parish by parish, we will be providing an opportunity for children in the targeted age group to be vaccinated. We will, of course, be sharing the list in terms of the locations. We'll be sharing that on the ministry's website, on social media platforms, and wherever we can share it, we will. We'll send it out via email, and we do have emails of practically all our parents across Jamaica, so we will do that. We will use all the venues we can, all the platforms we can to get this information out. We're also undertaking a public education campaign under the broad slogan of Get Vaxxed, Get Face-to-Face, across traditional print and broadcast media, as well as social media, to support the effort. And I want to acknowledge the Honorable Robert Nesta Morgan for the leadership in this regards. We are emphasizing that getting more people vaccinated, including children, is key in helping us to return to face-to-face classes. We've shared the broad outlines of the plan with the Jamaica Teachers Association, and have the assurance that they're fully on board. The current situation requires all hands on deck, and we're happy for the collaboration among ministries and the education and health sectors. Now we're saying to parents, now is your time to recognize the urgency of the time and take your children to be vaccinated. We are counting on everyone. Our teachers have taken the first step. They're out there. Significant number of them have at least one dose, and they're going back for the second. Now is your time in terms of your child to become vaccinated as well as you yourself. And we know that we can count on you to do this, because you, over the years, you would have been taking your child to a medical center to get vaccination for those childhood diseases that you would not want your child to get. And so this is part of our culture to take vaccinations. There's a lot of information that's available about it. We do, from time to time, have different fora in which we bring health professionals on to be able to ask questions. I know Dr. Tufton has his COVID conversations every week. So please avail yourself of information from credible sources, not from, TikTok or what you're seeing on social media, what somebody sends you on WhatsApp. Listen to the credible source. Listen to the Ministry of Health and Wellness. We at the Ministry of Education, Youth and Information will be echoing the information that we receive from the Ministry of Health and Wellness. And so parents, this weekend is yours. We expect you to turn out in your numbers across Jamaica. Help us to get our schools open again face to face. Help us to hear the joys and sounds of our children in the school, as they go to and from school and as they are in the classroom. Of course, you still have to observe all the protocols, especially on the way to school and back home. The mask, the hand sanitizing, the social distancing, in and out of the classroom. We still have to use that as part of the, our arsenal against this COVID-19 vaccine. So thank you, ladies and gentlemen, and I look forward to seeing you. I will be visiting some of the locations. So we look forward to seeing you at these locations. Thank you.
Thank you, Honorable Minister Favour Williams, Minister of Education, Youth and Information. We will now be taking questions. Please be reminded to use the raised hand feature, and also available online is Dr. Kassan Troop, Acting Chief Executive Officer of the Ministry of Education, Youth and Information, Dr. Melody Ennis, who is also on Zoom, Director of Family Health Services, Ministry of Health and Wellness, as well as Dr. the Honorable Christopher Tufton, who is the Minister of Health and Wellness, and our own Dr. Grace McLean. Please raise your hands as we identify you and then ask your question. The first question we have is from Mr. Javine McLean of CVM TV. Mr. McLean?
Yes, hello.
And then through the phase is pretty equal.
Hello.
Just short of.
Yes, we're hearing you.
For
14 meters 50.
Minister
Those
Tufton.
first two round jumps are 14.70.
There is a message circulating
Her best
across social
attempts.
media
That will end her competition.
purporting
In fifth
to
position.
be from cabinet.
Mr. McLean, could you give us a few seconds? We seem to have some disturbance on the line. Please hang on a second for me.
Just outside the medals, 14.87 for Anna Pelletero is currently in third position. 15.01 for Mamona. Having sat in third position going into round 5. Here she goes for Jamaica.
My apologies, Mr. McLean. Just give us a few seconds.
Oh, it's a real stretch for Ricketts there.
Do you have something in your background, Mr. McLean? We can't hear you.
What score is posted?
Can we then
No, I
move
don't-
on
no, I
to...
don't have anything in the
replay
background.
that her left foot is just dangling back behind. And really, if you want to really
Can
clean
we
entry
then
into
move
the
on?
pit,
We'll come back to you, Mr.
14.76,
McLean, but
just
can we go
short.
to
And
Miss
had she been
Kalisha
able to
Williams,
keep her
CVM
feet
TV?
together, let's just watch this. Good on the board, good phases into the jump.
attend school. Will that be approved as it is now for students attending face-to-face classes? So in other words, will unvaccinated students barred from attending face-to-face classes? And the other
Okay, in that vein, we're having a little technical difficulty, but we will be coming back to the Zoom questions. We have some questions on WhatsApp from journalists, and we will be asking. Mr. Prince Moore is asking, can I get clarification on the timing between the first and second dose of the Pfizer vaccine? That's the first question. And why not focus on the cohort of children who will be sitting exams given the limited number of Pfizer vaccines? And will there be vaccination blitz this weekend for persons wanting to take AstraZeneca vaccine? Dr. Tufton, will you be willing to answer those? And probably Dr. Ennis, who is also on Zoom. I'll repeat them for you, sir. Mr. Moore wants to know, can I get clarification on the timing between the first and second dose of the Pfizer vaccine?
Right. My understanding is 4 weeks, but Dr. Ennis, 3 weeks, but Dr. Ennis is online if she wants to confirm that. But it's 3 weeks between the first and second dose, which is why we would like to administer for the 15 to 18 now. Well, 3 weeks, 21 days, yeah, same thing. Which is why we'd want to administer the first dose as soon as possible to give enough time to administer the second, so that we give them full protection.
Second question is, why not focus on the cohort of children who will be sitting exams, given the limited number of Pfizer vaccines?
Right, so we are focusing on the 15 to 18, that's what was announced in the first instance, but we would like to give the 12 and up to 18. So which is why we say this weekend, if you have comorbidities, which places you at a greater risk as a 12 to 14-year-old, take your child to get the vaccine. But the 15 to 18 would be given priority this weekend, given the time constraints. We will do more sessions in the days and weeks to come. But ultimately, that priority has been established, even while we try to give from 12 to 18.
And the third question from Mr. Moore is, will there be vaccination blitz this weekend for persons wanting to take the AstraZeneca vaccine?
And the answer to that is no. We're prioritizing our young people, that 12 to 18 for this weekend. The locations that we're using are some of the very same locations that we would use otherwise for our regular blitz. And the bottleneck to facilitate, which has created this particular restriction, of course, are the people to administer the vaccines, the same people that have to administer. And there is a fairly large cohort within that age group, Minister. If it's 40,000 per year approximately, so 12 to 18, you're looking at, 15 to 18, you're looking at about 170,000. Even if you get a 50% turnout over that 4-day period, it's a large number. I mean, we have done 80,000 when we had to the first blitz, but it stretched the resources and the infrastructure and the personnel. So we have to manage in the context of the numbers. And we're hoping that as many as possible come out. The truth is, if 100% comes out, which would be ideal, we're going to have some bottlenecks and some waits. And I think we should say that. If half comes out, and you have done a poll, I understand, and shows that it's encouraging. So we are preparing for a number of persons, and we have to manage that process.
We can now go back to Zoom. Mr. Javine McLean wanted to ask a question. He's from CVM TV. Mr. McLean? Mr. McLean, are you hearing us?
Hello?
Go ahead, sir.
Yes. The question I was asking, there's a message on social media circulating, purporting to be from Cabinet, that the country will go on a lockdown for 3 days beginning tomorrow. And it's creating some sort of panic on social media. Is this information accurate? That's for the health minister.
You know, social media allows you to see all sorts of things from all sorts of sources. If there's an advisory around any policy position, it would come from the appropriate source. The Office of the Prime Minister is normally the legitimate source from which this flows, or respective ministers. There is no, as I understand it, announcement that has been made around any issues around restrictions. I will say we do have a cabinet COVID subcommittee meeting this evening. I think it's at 4 o'clock. And out of those deliberations around COVID, I'm sure that the Prime Minister or his designate will make any necessary announcements. But as of now, whatever you see out there would have to be considered fake news. Okay?
Before you leave, Dr. Tufton, there's a question coming from our Facebook Live that asks, are teachers allowed for the Pfizer this weekend?
Yes, we will accommodate teachers. In fact, we want to encourage our teachers, because remember now the focus is on the school resumption, and we want our teachers, we want the school environment to get vaccinated, I think, and I'm happy for that question. So if you work in a school environment, we would certainly accommodate you. Very, very important. Thank you for that question.
We'll now go to Miss Kalisha Williams of CVM TV. Miss Williams?
Hi, good afternoon. Correction, it's TVJ. Okay, I have two questions, one for Dr. Tufton and the other for Minister Williams. Okay, so we know of other vaccines being a requirement for students to attend face-to-face classes. Will this be a requirement? I mean, students attending school overall. Will this now be a requirement for students attending face-to-face classes? In other words, will unvaccinated students be barred from face-to-face classes? And the other question is in regards to pharmacies. Dr. Tufton, we've been getting reports from persons who say, why are pharmacies closed after the curfew hours? One lady, for instance, said she took her niece to the Bustamante Hospital, and after she got the prescription, even the pharmacy at the hospital was closed on a Sunday after the curfew. Those are my questions.
Well, as it relates to pharmacies and prescriptions or medication availability for persons within the public health system, patients that is, we're never really closed. Patients are on a regime, and they are administered to based on the assessment of the doctor. As it relates to pharmacies opening for the general public, the position has been that restricts you across the board. So if you have emergency cases, then you can go to a hospital and you get attention, and that could include also being medicated. So I mean that would be my response. It's not that it's closed to every situation. It's closed to non-emergency situations, and hospitals are open despite the challenges, and appropriate treatment can be administered based on needs.
Minister of Education, please allow them to sanitize before. Thank you.
All right, Minister Morgan, I think the question had to do with, if you
The
can repeat it.
question was whether or not unvaccinated children would be barred from face-to-face.
Okay, so you would have heard Dr. Tufton talk about the pace with which we will be vaccinating our students in our high school. The first blitz is going to happen over this weekend, but he also indicated that we have other batches of vaccines that we will be getting, and so it will take place over a period of time. As you can imagine, not all our students are going to be vaccinated. We'd love all of them to come forward to be vaccinated, but in the event they are not, we still will have our online school going, and we are giving priority to those students who would be fully vaccinated to return to face-to-face, and for those who are not, they would be accommodated in the online, the virtual world. Of course, as more of the Pfizer vaccines come on stream and they become vaccinated, then they would be in the face-to-face environment. But it's just being able to manage that transition as we make it through in terms of the various splits that we'll be having and the length of time that is required for the vaccination. So first dose, then 3 weeks later, and then 2 weeks wait time to become fully protected. Thanks.
Minister, I also think that the question was also interested in finding out what happens to primary and early childhood. We had discussed that though they cannot be vaccinated, we would look at the protocols to see how we can have some face-to-face for them.
Right. So thank you for that. In terms of our primary schools, I know our CEO has already been speaking, Chief Education Officer has already been speaking with our schools, looking at the capacity versus the capacity of our schools versus the enrollment and the space that's available, and arranging for schools where they have more students than the space would allow them to have, to be prepared for the rotation, to be prepared for some students to be online, some to be in the physical classrooms, to rotate so that all of our students get a chance to be in the face-to-face environment again at our primary school levels, at our basic schools, in our early childhood sector. So it's a management of this whole process and making sure that we all remain as safe as possible. Again, I want to repeat, whether you're vaccinated or not vaccinated, the COVID protocols are to be observed. In our primary schools, it's going to be crucial that we do that. Crucial as well in our high schools to continue to observe all the COVID-19 protocols.
Thank you, Minister. We'll now have a question from Mr. Chevon Campbell from the Nationwide News Network. Mr. Campbell. As Mr. Campbell comes forward, the question online asks, my son will be 12 in March. Should he get vaccinated? Next year, 2022, yes. Dr. Ennis, are you online? Can you answer that question?
It is next year. He has to get to age 12 before we will vaccinate him.
There's also another question. There's another question for you, Dr. Ennis.
Sure.
A lady says her son is going to be 12 in a few days. and he's asthmatic.
So he'll be in the next set, not this weekend, but as soon as he's 12, he will be vaccinated.
Thank you very much, Doctor. Mr. Campbell was asking, is the resumption of face-to-face predicated on specific take-up of vaccinations among students? If yes, what is that percentage?
Okay. So there isn't a set percentage. Officially, the school year starts September 1. The first teaching day will be Monday, September 6th. September 6th. We will be starting all of our schools, our primary and our high school, in the virtual world. For our primary, we believe that by the middle of September, we'll be able to be in the face-to-face mode. For our high schools, considering the vaccination that we will start this weekend, we believe that by the middle of October, those who are vaccinated will be back in the face-to-face mode. There will be a blend going forward, a blend of the virtual with the face-to-face as we go forward for this school term.
Thank you very much, Minister. Do we have anybody else online? I do not see any other person. Oh, we have one more. Mr. Andrew Sawyers. Miss Andrew Sawyers, my apologies. Please unmute your mic and ask your question. You're from the Jamaica Information Service.
Thank you, Minister Morgan. Good afternoon, everyone. Are you hearing me?
Yes, we are.
Okay. So my question is for either Minister Williams or Dr. Troop. I would like to know if any school buildings were affected as a result of the passage of Tropical Storm Grace. And I'd also love to get an update on any infrastructural projects that were on the way for schools heading into the new academic year. Thank you.
Dr. Troop is online on Zoom. Dr. Troop, can you unmute your mic and respond to that particular question?
Okay, thank you, Minister of State. Good afternoon to our ministers and members of the media, as well as the members in the room for the press conference. For that question, Minister, we have not been provided with any report of any kind of disruptions in our school that it relates to the physical infrastructure. As we are aware, the infrastructural projects that we would have approved for this academic year, those are ongoing, and our schools are continuing their work. We may have had a little disruption on the weekend because of the tropical storm, but most activities are on track from what we know, so we have no reports of any kind of disruptions at this point in time from our principals.
Thank you very much, Dr.
We have had
Troop.
a number of projects approved. We have spoken to our principals over the last couple of weeks. Our minister would have been meeting with our principals to speak to the infrastructure. We would have indicated that we have committed $1.6 billion this year for infrastructure upgrades in our schools. We have been disbursing the funds. We have been engaging into contractual arrangements with our suppliers and providers. And all of that is taking place guided by our building officers in our schools. So we have no reports of any kind of delays going on at this point in time.
We have another question from Mr. Moore, who is asking if, and this is to Dr. Tufton or Dr. Ennis, is the ministry planning to do first and second dose from this current batch of Pfizer vaccine, or will the ministry be getting a second shipment in time for the second dose? Dr. Tufton?
Okay, so the first dose we got was 208,000. I should correct that. I had said 204. We are prepared to use all of this up for our first application because we're expecting another dosage enough. Is it a few next month, sometime next month. So the total that has been gifted to us is just over 600,000 doses. And so the intention is to use that up for first and second dose. So depending on how many persons come out clearly, I had indicated the numbers before. Thank you.
Doesn't seem we have any more questions, so I suspect we can end now. I would like to thank all the members of the media who participated. Thanks to Dr. Tufton and his team, Dr. Ennis. Thanks to the Minister of Education, Youth and Information, the Honorable Favour Williams. Thanks to Dr. Grace McLean and Dr. Troop for participating. Please look out for more information from both the Ministry of Education and the Ministry of Health. Remember, you can go to educate.gov.jm or the Ministry of Health's website for information. Vaccination.moh.gov.jm. Listen to your radio, watch your television, read the papers. We will be rolling out significant amounts of content over the next 4 days to tell you where you can go to get your vaccination. The lists will be presented on social media. You can contact the schools that are listed so they can also give you more information, or contact your regional offices for more information. Thank you very much for joining us, and please go out and vaccinate.